Patient education on footwear and foot care in diabetes. These are the main topics we are going to cover today. First, we'll see why footwear is so important for patients with diabetes. Why footwear? Diabetic foot ulcers reduce people's quality of life, increase morbidity, mortality, and healthcare expenditure. Therefore, prevention of diabetic foot ulcers is of paramount importance. Peripheral neuropathy causes loss of protective sensation in feet, making people with diabetes more prone to repetitive stress and unnoticed trauma. Once an ulcer develops, healing is impaired by poor blood supply due to peripheral vascular disease and infections. Therefore, ulcers can progress, leading even to amputations. Walking barefoot or using inappropriate footwear increases the likelihood of repetitive stress and unnoticed trauma. Footwear helps to protect from unnoticed trauma, protect deformed foot from pressure-induced injury, and facilitate ulcer healing. When and where to wear. Motivate people with diabetes at intermediate or high risk of foot ulceration to wear their footwear at all times, both indoors and outdoors. Selecting footwear. These are the different parts of a footwear. An understanding of these parts is important when selecting footwear for a patient with diabetes. Typically, footwear consists of heel, a rocker profile, the front part curving upwards, outsole, insole, uppers, closure, tongue, and heel enclosure. Low, ankle high, and high are the different heights that footwear come in. Majority of diabetic patients have some degree of foot swelling. This is usually maximal towards evening and settles by early morning due to keeping feet in a non-dependent position. If a patient selects footwear in the morning, it may be tight for him or her by evening when feet get swollen. This could make them vulnerable to repetitive trauma and injury. This picture depicts how shoe length should be longer than foot length to accommodate the foot comfortably. Adequate depth to allow free movements of toes, width to match foot width, height. High footwear provide more firmness, stability, and reduced joint movement must be considered when selecting your footwear. Rocker profile is the front area of shoe that curves upwards. Pivot point is where curving starts. You should always wear the footwear and walk and see if it fits and whether there is any pain, discomfort, or tightness. Also, since fall prevention is important, you need to check if you're well balanced walking in that footwear. Footwear can have different types of closures, like laces with the tongue or buckles with strips, etc. It is important to avoid buckles in patients with diabetes to avoid trauma. Heel lift is distance from shoe sole to insole at the heel. Toe box, supple and accommodate shape of toes. Pointed toe box is not suitable for patients with diabetes as it will make toes crowded and more prone to trauma. Broad squared will be the ideal as toes can be accommodated comfortably. This is a type of footwear that can be worn by patients with diabetes to reduce the risk of foot ulceration. However, those with active ulcers may need specialized footwear to offload and help with wound healing. Footwear for higher risk feet. Foot risk categories. Low risk foot, no peripheral neuropathy, PVD, foot deformity, previous foot ulcer or history of lower extremity amputation. Intermediate risk, one of neuropathy, PVD or foot deformity and no previous ulcer or amputation. High risk foot, 2 or 3 risk factors or previous ulcer or amputation. intermediate or high risk of foot ulceration. Instruct people with diabetes at intermediate or high risk of foot ulceration to obtain footwear from an appropriately trained professional to ensure it fits, protects, and accommodates the shape of their feet. Those patients with deformed feet, such as Charcot's foot or with pre-ulcers, need specialized custom-made footwear. Those with ulcers need offloading footwear. This shows offloading footwear, which help with ulcer healing. Other aspects. Always wear socks within footwear to reduce shear and friction. Educate people with diabetes, their relatives, and caregivers on the importance of wearing appropriate footwear to prevent foot ulceration. Check footwear each time before wearing to ensure that there are no foreign objects in the footwear or penetrating the soles. Feet each time their footwear is removed to ensure that there are no signs of abnormal pressure, trauma, or ulceration. Review prescribed footwear every 3 months to ensure it still fits, protects, and supports the foot. Assess footwear. When a patient comes to the clinic, his or her footwear needs to be assessed. These points should be looked in for that assessment. Shoes and sandals are preferred over slippers. Footwear should properly fit and should be long and wide enough to accommodate feet without undue pressure. Backstrap helps to prevent footwear being removed accidentally. Summary: non-traumatic, seamless, smooth margins, cotton socks without elastic. Customization, insole and orthoses, offloading. Day-to-day use. Before use, check inside for foreign bodies and sole for sharp objects. After use, check feet for areas of trauma, redness, etc. Patient education on foot care. Foot care advice for patients with diabetes. Diabetes puts your feet at risk. Therefore, you need to take care of your feet like your face when you have diabetes. How does diabetes affect your feet? Diabetes damages nerves in your feet. Therefore, shape of your feet changes and you lose foot arches. Due to this abnormal shape, your feet become more prone to repetitive minor injuries, which can become large wounds with time. Also, since you can't feel pain, even prick injuries can go unnoticed. Due to diabetes, small blood vessels which supply blood to your feet get narrowed. So wound healing also doesn't occur properly. Also, risk of infection is high when you have diabetes. All these things can finally result in an amputation of your limb. Since it will be a major loss in your life, caring for your feet is very important. How to take care of your feet. Inspect your feet daily. Check for cuts, blisters, wounds, corns, or any redness and swelling. Check nails for any color changes. You can use a magnifying hand mirror to check your soles. If there is any abnormality, please contact your doctor. Clean your feet daily with lukewarm water. Ask someone else to check water temperature. Also, dry your feet after washing. Make sure to be gentle when you wash and when you dry. Moisturize your feet, but not between your toes. Cut your nails carefully. Cut them straight across and file the edges. Get someone's help if you find it difficult. If you find a corn or a callus, please get a medical assistance. Don't try to remove it yourself or use home remedies. Always wear footwear, even inside the house. How to select footwear was previously discussed. How to take care of your feet. Shake your shoes and feel inside before wearing. Don't sit with your legs crossed or stand in one position for a long time. Never keep any hot object in contact with your feet. Get your feet examined on a regular basis. Control your blood sugar level and stop smoking. Thank you.